A report that's been released this morning shows a growing crisis in the provision of special educational needs and disabilities, that SEND services in England, highlighting significant disparities between the resources in private and state schools. Private schools, often better resourced, have developed more tailored approaches, more specialised teaching resources, more staff to SEND support. They benefit from a wider array of specialised resources and staff, which allows for more personalised attention to students with SEND. I know this myself from the last few schools that I've been in. And certainly the private schools, there's very well equipped SEND support. However, this is being threatened by the changes that could reduce these provisions, particularly with potential funding cuts, shifts in focus, and the VAT imposition on private education. And the access for SEND facilities for particularly private schools extends beyond those who have got a formal recognition, a formal diagnosis, which can take up to 2 years to acquire. So that's 2 years during a child's education at a critical time when they're going through the process of trying to be diagnosed, when they will not be receiving adequate help through the state system, even if it is available. It makes you think, doesn't it? Because education doesn't take that long in the overall view of things. Primary education is over in a flash. Secondary education, you're immediately in exams. State schools are increasingly overwhelmed, and the report underscores how state schools are disproportionately failing SEND students. Despite 16% of students in state schools having special needs or having special needs identified, 22 of those missing from education altogether, 22% of those missing from education altogether are SEND children. And this alarming gap reflects an education system that is ill-equipped to support these students, with school leaders citing insufficient funding as a major concern. One of the most shocking revelations is the number of SEND children entirely missing from education. That's about 2,900 in the last year. And these children are neither enrolled in schools nor receiving appropriate education elsewhere, leaving them at significant risk of neglect, social exclusion, and long-term educational disadvantage. The new Children's Commissioner, Dame Rachel de Souza, has called this a scandal, and she is quite right. She's emphasised that improving SEND provision is vital for safeguarding children's right to education, and her report suggests that the number of children falling through the cracks points to systemic failings both in tracking attendance and in ensuring appropriate educational provision for SEND children. While EHCPs, that's education and healthcare plans, are supposed to provide a safety net for these students, securing one is a battle for many families. The process is bureaucratic, slow, and in many cases under-resourced. Even when parents succeed in obtaining an EHCP, schools struggle to implement the necessary support due to funding constraints, forcing many parents to resort to homeschooling or specialised private education if they can afford it. That is the reality. And one proposed solution is the introduction of unique identifiers for all children, akin to NHS numbers, to help track and monitor those missing from education across various councils and agencies. This could potentially provide a clearer picture of the SEND children's whereabouts and ensure that local authorities and educational institutions are better equipped to intervene. Today's report paints a bleak picture of SEND provision in England's state schools. The challenges are multifaceted: lack of funding, bureaucratic hurdles, insufficient oversight, all of which contribute to a system that fails to support the most vulnerable children. Urgent reforms, particularly around funding and tracking, are essential to ensure that SEND children receive the education they deserve and are not left behind. Only through collaborative efforts between government, schools, and families can we begin to address these disparities and restore faith in the education system for SEND children particularly.